and in Sakumono. And this morning we're talking about diabetes and how it affects your eye. Now, I'm sure that, like me, a lot of people do not even know there was a correlation, because then, you're thinking diabetes, you're thinking all kinds of things, minus your eye. But today, we're going to get educated on how the two come together and how they affect you. Good morning, Dr. Sylvia.
Hi, Natalia.
How are you?
I'm fine.
It's been so long.
Yeah.
I miss you too. So let's jump straight into it.
Okay.
First of all, I know that a lot of people may have an idea of what diabetes is, but if you can give us, a little breakdown of what diabetes is, first of all, before we continue the conversation.
That's okay.
Okay.
I miss your listeners as well. I'm happy to be back.
Right.
So, diabetes is generally a chronic condition that affects how the body processes sugar in the blood.
Right.
So it's either the pancreas is producing little to no insulin, that's type 1 diabetes, or the body is having troubles, processing sugar that is already in the system, and so it leads to increased blood sugar, which is type 2, which is the common type of diabetes people tend to have in our part of the world. So I'm saying it's chronic because, once it sets in, it stays with you. It's something that you would have to live with for the rest of your life.
Right.
Unlike, let's say, malaria, where you take your medication and, the condition goes away.
Okay.
With diabetes, it stays with you.
Right.
So it's a chronic condition.
Okay. Now tell us how this affects your eye. I mean, you talked about type 1 and type 2. And also because for the layman, and I would consider myself a part of layman, we think that type 1 diabetes is usually affects children. And then type 2 is usually older people. Is that true or false? Or it doesn't really matter?
It doesn't really matter. Diabetes will affect you if it has to affect you.
Right.
And most often, it's also more like a condition that runs in the family.
Okay.
And so once there's a family history, chances that you will develop it is high. So it doesn't really matter your age or the type you're going to
have.
Yet all the type you're going to have.
Okay.
So... to answer your question,
okay.
No, it doesn't really matter.
Okay.
And it's not, there's not a cutout, measure to say that you are going to develop type 2 or you are going to develop type 1.
Right.
We make the diagnosis based on the signs and the symptoms and other things that we look out for.
Right.
Yes.
Okay, but type 1 is caught much earlier?
Yes.
Much earlier.
Yes.
Okay.
And type 2 will be more like... as a result of lifestyle and genetic in the sense that if it's something that runs in the family, then you're likely to.
Right. So then you're going to have to not throw caution to the wind at all.
Yes.
All right. So now let's talk about the correlation. How is my eye involved in this conversation?
Okay. So we take the eyeball to be like, should I say an egg? Okay.
Okay.
So the eyeball has other structures within it.
Okay.
And the major thing I'm going to be talking about will be the blood vessels in the eyeball.
Okay.
Now, the blood vessels in the eyeball supply the eye with oxygen, with nutrients, and blood.
Right.
This is important because that is what helps the eye to function to, its optimum best.
Okay.
Okay. So... when your blood sugar is high, in this case, I'm talking about type 2 diabetes, which is the most common, so that's what I'll talk about.
Okay.
Where your blood sugar is too high, your body is unable to process the sugar in the blood very well. The sugar leaks into... It doesn't leak, it's in the blood, and the veins are what carries the blood... The veins are what carries blood to every part of your body, from your head to your toe.
Right.
So certainly you have blood running through your eyes as well.
Right.
Now, the body is not used to having so much sugar in the vein. Your eye is not used to experiencing so much sugar passing through it.
Right.
So what happens is that excess sugar in the blood is going to alter the state of the blood vessels in the eyeball. Eventually, what happens is that it's going to cause what we call microaneurysms. When you have diabetes, you are predisposed to developing what we call diabetic retinopathy.
Okay.
What that is that it will cause you to develop certain conditions in the eye. Collectively, we call it retinopathy, diseases of the eye as a result of diabetes.
Okay.
Now, the retinopathy happens in stages. How the diabetes affects the eye is that I was in the beginning talking about how the sugar affects the veins in the eye and all of that.
Right.
Now, it's going to cause microaneurysm. Microaneurysm is bulging of the veins in the eye.
Right.
So you take the vein in the eye to be like a straw, what you put in your drink to take a sip to finish your drink, okay? And then we take the sugar molecules to be, let's say, the size of a regular apple.
Right.
So imagine that apple trying to fit through the straw that you're taking your drink with.
Right.
It's almost impossible. But in this case, because it's happening in the body, the sugar has already found its way, which in this case, you take it to be like the size of the apple, has already found its way into the straw. So you see that it's causing the straw to bulge. So it's a similar thing that happens in the eyeball. It causes the
Right.
veins to bulge. They swell up because I'm not used to having so much sugar passing through me.
Right.
That's in the first stage. In the second stage, which is the pre-proliferative stage, because the veins are generally very weak, they are not built to process that amount of sugar in the blood.
Right.
The bulging eventually breaks. So in the second stage of the diabetic retinopathy, you tend to have bleeding in the back of the eye, what we call hemorrhage.
Right.
Now that is where the problem is. Once the bleeding starts, chances, if it's unattended to, if it's not treated, you could just lose your sight in a split second.
Wow.
Yes. Blood is not supposed to be in the eye. So once it's there, it goes to touch things.
Wow.
In the third stage of the retinopathy, the individual is likely to develop what we call retinal detachment
Okay.
because the breaking of the blood vessel causing the leakage into the back of the eye, eventually scars will form. New blood vessels will also form. Generally, it's going to just distort the whole buildup of the inside of the eye. The eye
Right.
is not used to that. By itself, it will want to fight back.
Okay.
By its own mechanisms, it will try to fight back,
Okay.
causing the scars and all of that. Because it's a very thin layer at the back of the eye, when the scars are forming, they sort of pull on the retinal layers.
Right.
And so, like you develop a wound on your skin, and then it's healing and it's forming a scar. You see how hard the scab.
Yeah. It pulls. Yeah.
Exactly. So it pulls on the surrounding, should I call it skin or layer? And so depending on how much scars are forming at the back of the eye, this one is pulling, this one is pulling, this one is pulling. Eventually it causes the retina to just pull off, and then the detachment happens. When there's detachment, unfortunately, you lose your vision.
Wow.
The sad thing about diabetes and how it affects the eye is that when it's starting, it doesn't give you any marked symptoms or signs.
I was actually coming to that.
Right. You don't necessarily feel anything until it's entering into the advanced stages. That's when you begin to feel blurredness in your vision. And the blurredness doesn't come and go. It's like as the day goes by, the blurredness is getting worse. Yes. Some people also experience some unexplained redness of the eye.
Okay.
Some people also would experience, when they're looking at things, it's like it's on and off. It's clear, and then it goes blurry, and then it comes back to be clear again. So somebody would ask, how do I know I have diabetes? I haven't been. You'll be surprised somebody has never been to the hospital, not even to check their eye, but for a regular, I'm just coming to check if everything is going on well with me. There are some people who have never been to the hospital.
A lot of people, as a matter of fact.
So how do I know if I have diabetes? If you find that in the middle of the night, you wake up feeling so thirsty, your throat is dry, that is a cause for concern. And if it's something that happens so often, you need to be worried. If you're somebody who wakes up several times in the middle of the night to take a pee, frequent urination, that's also a cause for concern. I'm talking about the signs of diabetes.
Right.
So we have the blurred vision, we have increased thirst, especially in the middle of the night. We have frequent urination, also especially in the middle of the night. Fatigue. If you're constantly tired, whether you just woke up from sleep, you're still very exhausted. It's like you didn't have enough sleep, although you've been sleeping for several hours.
You wake up tired.
You wake up tired constantly. And if you're somebody who consistently has hunger pangs, you are always hungry. No matter what you eat, you still want more. You still feel like you're hungry. If you don't get food to eat, it's like you're dizzy and all of that. You need to rush to the hospital. Just check to be sure that you're
everything
safe.
Is okay.
Yes.
What about cravings? Does it give you, is part of the symptoms any particular cravings? Like, are you craving sweet things all the time? Maybe salty things? Like, what about cravings?
Yes. Diabetes will also make you crave a lot of sugary things, especially when it's in uncontrolled levels.
Okay.
All these things will happen to you when it's in uncontrolled levels.
Right.
Or you don't even know, you haven't been diagnosed, but you're living with the condition. You'll experience all these things. So yes, cravings, and a lot of the time is for sweet things. I want to eat cake, and you want to eat it so bad. I want to have a sugary drink, fizzy drink. It's always, the cravings are so bad that if you don't satisfy it, you're just not fine.
Okay.
Yes. Yes.
Very interesting. And so for people with these symptoms, especially because in our part of the world, going to the hospital is such a task. One should feel like they're about to die before they walk through the doors of a hospital. It's so typical of Ghanaians.
Yes.
Because I've lived here, so I can only speak for here.
Yes.
It's so typical of us. So for somebody who may be going through these things, you would say that please go to the hospital.
Yes.
Right? I've also had people who would say things like, oh, I started feeling unwell, but I want to use my lifestyle to change how I'm feeling, because I hear that a lot of the time, like, oh, in fact, only a couple of weeks ago, I had some people who are from Bisayen, and they talk about cancer. And in their experience, because they have traveled to different regions, people will say things like, oh, when I went and I got diagnosed and they told me I had cancer, I decided that now I'm going to change my lifestyle. Now I'm going to eat only greens. Now I'm going to eat a lot of contumely, and I'm going to eat this. And now I'm going to walk maybe an hour before I sleep, and this and that and that. After they have been diagnosed. People do those things.
Right.
People decide that I'm going to change my diagnosis with lifestyle. What would you say about that?
It's actually a step in the right direction.
Okay.
However, in the case of, let's say, diabetes, as we're discussing, if you do have the condition, it's best to go on the medication. And also, it depends on what stage of the condition you're on.
Okay, how many stages are there?
3.
Okay.
So, depending on the stage you're on, if you're in the very beginning stages, or let's say pre-diabetes, or let's say insulin resistance, a lot of the time, according to research, lifestyle changes could, I'm
Keyword.
saying could.
Right.
I don't want anybody to misquote me anywhere.
Keyword could.
Lifestyle changes could reverse the situation.
Okay.
Okay. And when I talk about lifestyle changes, if you're somebody who lives a sedentary lifestyle, once you get to work, you sit down, you sit for 9, 10, 12 hours, you close back in the car, you get home, you eat straight to bed.
You eat in bed.
Eat in bed, fall asleep almost immediately.
Yes.
That's not too good. So you would want to incorporate, physical activity. You don't necessarily need to go to the gym. I am a culprit. I will register and I won't even go because I can't make the time to go.
Yeah.
Right. So you can do things that are more sustainable. You're either doing very early morning walks, late evening walks. If you have a bicycle, you can use that. Take a long ride. The whole idea is to get you to move, change your lifestyle. So a lot of the times, yes, it could change the situation, but if you're already advanced in diabetes, where your pancreas is already suffering and all of that, I'm sorry, but physical activity will not do anything.
Much. Change in diet won't do much.
Yes, the harm is already being done, and very little can be done to reverse it.
Okay.
However, if you're 12 years and above, you need to take physical activity seriously.
Right.
We're all guilty, and the excuse is work. Oh, I'm not making time. Oh, I'm tired. But if it doesn't, it has to be sustainable. That's the key word, sustainable. Something you can always do that will not take so much away from you. So 30 minutes walk in your neighborhood, even in your house. If you have a self-compound, you can just go around the house multiple times. Just get your heartbeat.
Go up and down the stairs.
Up and down the stairs. If you have a skipping rope, skip 10,000, 1,000. Don't kill yourself, but it should get you to break sweat,
You mean 100, 200? If you say 1,000.
Well, yeah. You can start from 100, but, you challenge yourself and
to grow.
Yes, challenge yourself to do more. Get your heart to work. Get your internal organs to work.
Yeah.
Because, just as the body gets lazy, that's the same way the organs also get lazy.
Yes. You need to activate them.
Yes.
All right, so for someone who may already be living with this condition, now how do they protect their eyes?
Right. So the first step is, please, if you don't have an optometrist friend, I think you need to.
Everyone needs one.
In your directory of friends, you need to have one optometrist on speed dial.
Yeah.
If you already have diabetes, if you've been diagnosed of diabetes, if you're on medication for diabetes, you need to have an optometrist you can always go to. Okay? There are eye clinics all over, spread around, in the country. Just walk into an eye clinic. Please, I want to have a screening for my eyes. I'm diabetic and I just, I'm not really having any symptoms, but I just want to check to be sure. We take you through the process, check what needs to be checked, if we need you to, do further things. And a lot of the times we may have to refer you to a general physician to take care of the systemic parts of the whole thing. So we work as a team.
Right.
Also, depending on the stage, if the retinopathy hasn't set in yet, you're safe in quote. Safe in the sense that at that moment, the retinopathy hasn't started. The bleeding at the back of the eye hasn't started. Scars haven't started forming. So, in that instance, we would rather want to help you keep your blood sugar levels at a constant low.
To prevent that.
Okay. It's when the blood sugar goes high, that's when it gives you problems. And not just going high, when it's uncontrollably high. Right. There are instances where you may be put on the medication and all of that, and your sugar is still not dropping. Yes.
Wow.
Yes.
And also because I think that, one of our other doctors who comes on the show mentioned that usually when people hear diabetes, they're thinking that, you must be someone who's always taking lots of sugar. But that's not the case at all. It is lifestyle.
Yes.
It is all the carbohydrates, because then the carbohydrates become sugar in your body.
Yes, the body converts it to glycogen.
Yes. So, and typically for us, as Ghanaians, almost everything we eat is carbohydrate.
Our breakfast is kenke, wache, fufu.
Everything. Like this morning, I woke up and I'm craving kenke. You know, that's what I want to eat. And I know I'll eat it before close of day.
If you're eating it for lunch,
yeah,
that is ideal.
Right.
If you're eating it for breakfast, I know a lot of people will come at me for this, but if you're eating it if you're having, so let's take a typical day.
Right.
You're having kenke for breakfast, carbohydrates,
Right.
and you're obviously not eating one bowl, maybe 1.5 or 2. In the afternoon, you're probably having yam and something, maybe kontomire or whatever,
Right.
carbohydrates. In the evening, you're having...
In the afternoon, typically, I know for a lot of people at work and stuff like that, they'll eat banku, rice,
fufu, carbohydrates.
Right.
In the evening, you get home and, I come to me, okay. You probably do fried yam, you do rice in whatever form, jollof, fried rice. Basically, everything we eat in Ghana is carbohydrates.
Yeah.
Now, it's up to you to try to stay in a calorie deficit. What I mean is that I'm not saying you shouldn't eat your kenke, but try and be reasonable with the amount of food you eat. So you can't have 3 bowls of kenke at a go, one person. No.
I know.
So why don't you rather do more of protein, vegetables, and then have a half bowl of kenke?
Yeah.
You will be full. You'll be satisfied to take... I mean, the satisfaction will take you a couple hours through the day.
Yeah.
But somebody will have 3 bowls of kenke for breakfast. The person will have rice in the afternoon, get fufu in the afternoon, get home and still eat rice. So that's like you're loading your body with so much carbohydrates.
Yeah.
The body will convert it to sugar. Where the body is not able to process that sugar, it will reconvert it to fat, and the fat is stored under your skin. So you say that, I'm not eating so much, but I'm gaining weight.
Right.
Weight gain is also one sign of diabetes.
Right.
Uncontrolled weight gain.
Right.
In some people, it's uncontrolled weight loss.
Right.
But typically, you find that there's uncontrolled weight gain, which is also a classical sign of diabetes.
Right.
Somebody will say, "Oh, I've always been big. It's not. There's nothing making me big. I've always been big since I was a child." So you can let somebody check the back of your neck.
Yeah.
You know, you see something darkening.
Yeah.
At the back of your neck.
Yeah. It shows some lines.
Yes.
Some darkened lines.
Darkened lines, and it has a velvety appearance.
Yeah.
And even when you touch it, it's quite smooth.
Yeah.
You will just notice that something is going wrong at the back of your neck. That's a sign of insulin resistance, and it's a cause for concern.
Yeah.
You need to visit your doctor. Yes.
Right. Interesting. And I think also in having conversations on diabetes, we're going to move and talk about, I think we touched on for people who what's it called, hasn't started yet, hasn't kicked in
the
yet.
retinopathy.
Hasn't kicked in yet. They can find ways to control or prevent it.
Yes.
But then we'll look at people who have already had it kicked in
Right.
and what they need to do.
Right.
Before that, though, the idea of breakfast, I think is also an idea that was just made for children, really, because for adults, I think I've come to learn that before you wake up, the reason why you wake up having energy to move is because your body pumps a lot of sugar in your system to give you the energy you need to move. And then typically we wake up and we eat sugar for breakfast on top of the sugar that's already in the system.
Yes.
Double the dose, which is quite crazy, won't you say?
Yes. Actually, yes, it is. You're overdosing your body with sugar.
Right.
Whether in the form of food or in the form of drink, you're already adding on to what the body has already processed from the previous day's meals.
Right.
The kenke, fufu, and all of that that you had. So, personally, I don't take breakfast.
Okay.
It's just a personal thing. It's not like It's just a personal decision.
You already have the energy you need to move.
Right.
Right.
So my first meal in the day typically will be after 12 o'clock.
Okay.
That's when I'll have and I'll eat anything. It could be kenke, it could be fufu, it could be anything. At night, if I am feeling so hungry, I probably will just do green tea. I'm not looking to lose weight. No. I'm just trying to stay in a calorie deficit.
Right.
So I try to have just carbohydrates once in a day so that my body can burn it completely. And then it doesn't have to store any excess.
Right.
So staying in the calorie deficit is the most important thing.
Right.
Ghanaians eat too much.
Yeah. And in the morning after your body pumps the sugar, you hear people, they'll go and buy cocoa from the cocoa side. Say,
Yes.
Mami, sugar, baby.
Ma sugar ninkum.
Ma sugar ninkum, mami. And also there's all the bread that we eat, all the
White bread.
that we eat.
Yes.
And all the the pastries, the donuts, the
You
this,
know,
the that, the that, the
you
that.
need to cut back on sugar, salt, and fat. Sugar, salt, and fats. These are the three things that are hurting us right now.
Yeah.
Somebody wants to have bread, and there's margarine, there's butter, there's this, there's
And
that.
and the egg that's laying in it too
egg,
has salt.
sardine, corned beef, all.
Yeah.
In as much as you want to show your sign of affluence, your body will also show you later on in life.
Yeah.
Yes.
We need
So
to be
we need to be responsible with our eating.
Yeah. Okay, so now let's go to the retinopathy.
Right.
For people who have had it kicked in already, what will they do? What's the solution for them?
So for people who already have the retinopathy kicking in, first line, we need to reduce your blood sugar levels.
Okay.
Okay. So if you are not on medication, we refer you to your GP so that they start the treatment for, managing the diabetes.
Yeah, to get you on medication.
Yes, to get your sugar levels to normal. But if you are already on the medication and you're still showing signs of the retinopathy, there are other things we would look at. And then based on that, we know what to do for you, whether to put you on laser, whether to do some surgery to, get out the blood that is already leaking at the back of the eye. So it all depends.
Right.
It all depends. But yeah, first line, we'll put you on diabetes medication. If not, you probably may have to go through surgery on the eye, or laser is also an option. The laser is to burn the new blood vessels that are forming at the back of the eye, which leads to the bleeding. So, yeah, it depends on
to just make sure that you have your vision for as long as you live.
Yes.
Which is the most important thing.
Yes. And there's one thing I want to say, and this goes to our men. A lot of them choose not to take their diabetes medication because
they say that
it affects erection. Please.
They would say, I'd rather go blind. That's what they say.
And I get it all the time. I'd rather go blind than.
Yes.
But please, you need your eye for everything. We understand where you're coming from, but you need your eye for everything. So our daddies, uncles, husbands, brothers who are refusing to take their diabetes medication because it's going to affect erection, I'm begging of you, we need you alive.
Yeah.
Please.
It's important.
We need you alive.
Yeah. It's really important.
Yes.
That is some great insight, Dr. Sylvia. Great insight. So for anyone, if you have had this conversation and you can identify with some of the symptoms that we have just talked about here, please try and see your GP. And also find, like Dr. Sylvia said, you cannot be living and not have an optometrist. It's important. You need to have a dentist. You need to have an optometrist.
Yes.
You need to have all these people around you because they help you and your body, to be on the right path all the time. All the time. I have a lot of dental issues. You won't believe it. When I was growing up, I'd chew a lot of candy. And the idea of brush your teeth before bed was not my best friend. So, oh my God, so much cavity. As I sit here, I think I'm missing like 6 teeth. You won't believe it.
Oh no. Sweet tooth.
Yeah, sweet tooth. So, and you know that your teeth, if you lose certain teeth, it affects the way you speak and sound. So I have I mean, I used to sound a certain way. Now I don't anymore because I realize that I'm not getting, you know,
Right. Right.
yeah, maybe soon enough.
Right.
I'll fill them in and make sure that.
So, Natalia, I'd want your listeners to please take our discussion quite seriously.
Okay.
Diabetes and diabetic retinopathy does not give you clear-cut, signs. Like when you have malaria, I have headache, I have nausea, I've lost my appetite. You don't feel any of these things. Please just take time out of your busy day, walk into an eye clinic, have your eyes checked as often as is possible.
Right.
If you have family history of diabetes, where your mother, your grandparents, anybody in your family that you know may have had diabetes in the past or present, please, you are also at risk. Do go through an eye clinic, have your eyes checked, and be sure that you don't have any of these. And it shouldn't be a one-time thing. It will have to be,
Continuous.
yes,
Yeah.
continuous, screening,
Okay.
just to be sure.
Okay, absolutely. And how can people reach you? Maybe there's someone listening, they may want to reach out to you.
Right.
They may have personal questions.
Okay.
Something.
So you can reach me on 0555 478678, 0555 478678, or you can walk into any branch of Lotus Opticals at Sakumono, East Legon. We're on Google Maps, we're on Instagram. Very easy to find us, and just ask for Dr. Sylvia and you have access to me.
All right. Thank you so much, Dr. Sylvia.
Thank you for having me.
It's always so
Natalia.
insightful when you come through the studio.
Right.
All right. So if you have been listening to this conversation, you know exactly what to do. Not just because you're diabetic, but you need to make sure that your eyes need to last you a lifetime. For as long as you live, you need to be able to see and see well. So be sure to